category B. There's a list of them here. The phenylprofen, ibuprofen, and naproxen are category B, which is relatively safe. The difluzinol, tomatin, methanoic acid, these are drugs that are not real common, except the difluzinol can be used in dentistry, should not be used in a pregnant woman. Drug interactions, if someone's taking lithium, which is a drug, a psychotropic drug, which is often prescribed for people that have bipolar disorder, they should not take NSAIDs, okay? It may induce the toxicity because it knocks it off the protein binding sites. Yes, Jess?
The ones that should not be given to pregnant women, is that pregnant in nursing, like after they give birth, or
No.
just whoever?
No. As I said, the ibuprofen can be given to a woman who's nursing because there's minimal amounts in the breast milk, but that's the safest one. Yeah, I remember that with my daughter actually. Okay, drug interactions, I talked about the lithium. Digoxin, which is a heart medication for congestive heart failure, it should not be given with that. Some antihypertensives have a warning about taking NSAIDs, and again, you have to weigh risk and benefit, and doctors should be contacted about that. The probenecid, it may increase the levels of NSAIDs, so they are taken for people with gout and probenecid. Again, look at doses and look at reaction. We would not be making that decision. Their medical doctor would make that decision. And drugs like cyclosporin and methotrexate, it can increase their toxicity as well, just like the aspirin with the methotrexate. Some contraindications and cautions. People with asthma have to be really careful of aspirins and NSAIDs, but they are known to take it. People with renal or kidney disease, coagulation problems with their bloods, peptic ulcer, ulcerative colitis, all those GI type things, they should be careful with. And some of the cardiovascular drugs. There are black box warnings that are put for NSAIDs on people with for cardiovascular thrombotic events, for bleeding events. People that have had myocardial infarction, stroke, and GI events need to be careful of these medications. So we can't, even though they're just NSAIDs, we can't just across the board prescribe them. If someone's taking a lot of these medications and has these cardiovascular problems, we should check with their doctor. Uses, we've talked about a lot of them already: osteoarthritis, rheumatoid arthritis, gouty arthritis, fever, dysmenorrhea, pain, okay? And they're also used for joint pain and a lot of different other things. Dentally, NSAIDs are extremely valuable. They are equivalent to opioids in the way that they relieve pain. Generally, in dentistry, opioids, we're going to cover that shortly, are given for people that either can't tolerate NSAIDs, and there are people that can't, or they're given a small dose of an opioid but with an NSAID along with it. So extremely valuable for dentistry. The usual doses of NSAIDs are as effective as about 650 milligrams of aspirin or acetaminophen with codeine, and there are intermediate strength combinations that combine that little bit of codeine or another opioid with some of the NSAIDs as well. These are some of the specific drugs. We'll talk about them individually: ibuprofen, naproxen, the COX-2 specific agents, because there are a couple of those. Ibuprofen is really common. You guys have all taken it. You're going to prescribe it for your patients. It is the drug of choice for dental pain when an NSAID is indicated. So when you've made the distinction that this patient needs an NSAID, okay, it is often the drug of choice because of its analgesic and its anti-inflammatory response. Usual dose is 400 to 800 milligrams every 4 to 6 hours. It can be prescription, okay, but 200 milligrams are available over the counter, right? 4, 6, and 8 are a prescription required for. The half-life is only 2 hours, and there are rare side effects, and usually they're only at high doses. These are some of the other drugs. Naproxen you've heard of. It's the one that is only dosed every 12 hours, so some people find that very convenient. They take medication often. It has a longer half-life, as I said, 8 to 12 hours. And it's often given, if it's given before a procedure, it's given with a loading dose, 500 milligrams right away, and then 250 to 275 milligrams every 6 to 8 hours. Yes?
Would you like us to know the dose amounts for the test?
Would I ask you the dose amounts? If it were, important to the question, like if I'm talking about low dose aspirin as opposed to aspirin for analgesic effect. I'm gonna ask you about this whole procedure with doing this here. Maybe, maybe not. I mean, the drugs to know, you might want to know what the usual doses are, because the importance of knowing the usual dose is when we talk about some of the negative side effects. If we know a patient is taking more than the usual dose, that would be a red flag. So yeah, I would say so. And remember that with as with aspirin, with lithium, it can inhibit the clearance of it, so it could make the lithium work more than it should, which would be a bad thing. There are a couple of other drugs that are listed under these categories. Ketorolac is a newer one. I don't see it used that often, but for moderate to severe pain relief, if you're avoiding an opioid, it may be used. Generally, it's only indicated for patients that are having like a surgical procedure where it's given IV and then they continue with it for a couple of days. So you would only see this usually with like an oral surgery type of appointment. And usually when practitioners use it, and we're not going to be making this decision, but usually when practitioners use something like this, they use drugs that they use frequently. They know how most people respond to them. So you may have an oral surgeon appointment. Maybe you're working for a doctor who does implants or periodontal surgery. They might use something like that. So you might see that. Okay, so we talked about when something is non-specific COX inhibitor, like with COX-1 and COX-2, the negative side effects is because it also inhibits COX-1, right? That has all those good effects on our GI tract. So the thought was that they could make something very specific to inhibit only COX-2. That would be a good thing. Doesn't that sound like a good idea? It does, okay? So they actually released a few drugs that in clinical trials, they did really, really well with them. And remember, when you release a new drug and you go through all the drug trials and you use a limited amount of people, and then you increase the amount of people, and you're seeing what the safety is and what the efficacy is and all that. And then they release it to the world, and then they do the post-marketing data, if you will, on the adverse effects that get reported. Well, what happened is a couple of them went out there, particularly Vioxx and Bextra. They were actually removed from the market because they found a higher incidence of people with cardiovascular events afterwards, okay? Not good, okay? So a statistically significant number of people were dying from heart attacks after taking these medications compared to people of the same, medical, that had the same medical issues that didn't take them. So they were pulled from the market. The only one that was not was called Celebrex, celecoxib. It's still on the market, okay? It's for people with osteo and rheumatoid arthritis because they find it very, very beneficial, but it does carry that risk, and they wouldn't give it to someone who had previous cardiovascular disease. Now, in a separate category by itself is acetaminophen, okay? Again, a really, really common drug. We think of it as quite safe, but it does have its problems. We know this is Tylenol. You also may see it as APAP. You're going to see the combination with opioids called APAP, okay? APAP is, I had to write this down, acetylpyramidophenol. That's why we call it APAP, because it's harder to say. It's the chemical name for it. But you will see that. I see that. You see that in European medications. You see the APAP all the time. It's an analgesic. It's antipyretic. It's often used for people who can't take aspirin. Remember, like those kids that have the flu. The exact mechanism is unknown. That's helpful, okay? But we do know that it reduces the pain threshold, so it does reduce the reaction to pain. And a very popular, very dynamic speaker on pharmacology, he's actually a pharmacist that comes out and speaks, and I hope you get to see him at some time. His name is Tom Viola. He talks about the magical combination for normal, fairly healthy people of taking one ibuprofen and one Tylenol, okay, when you have like a lot of muscle pain. Or he said he takes one of each of those if he's helping a friend move, those times when you help a friend move and you kind of overdo it. So it is kind of a magical combination. So on the rare occasion when I do take medication for pain or inflammation, especially like, I was telling somebody coming up the stairs, I didn't do the stairs, I actually did the elevator. Like I did like a 30-minute workout this weekend. I haven't worked out in so long, like I feel like I just ran a marathon or something. It's ridiculous. But that's when I might take one of each of those. So it raises your pain threshold, and then the ibuprofen gets rid of the inflammation, because we know that there's no anti-inflammatory effect from acetaminophen. So that's why we don't always choose this for dental pain, okay? But it does have an anti-fever, and it does, of course, have analgesic effect. It's completely absorbed in the GI tract. It only takes about 1 to 3 hours to work. Short half-life, 1 to 4 hours. It's metabolized by liver microsomal enzymes, okay? Microsomal enzymes are what are in your liver that do a lot of the metabolizing of drugs, and they can get actually saturated. We'll talk about this with some of the other drugs that we get. So when you take large doses of this, okay, a metabolite is made. Remember, the metabolite is what our body packages up drugs as sometimes. That's thought to be toxic to the liver, okay? So too much of this stuff is definitely a bad thing for your liver. People with liver disease should not take this. And indeed, the toxic effect of acetaminophen is liver damage and death, necrosis of the liver, okay? So that is how people die from taking too much acetaminophen. It happens. It has the same potency and same efficacy, by coincidence, as aspirin, okay? But no anti-inflammatory effect. Fortunately, it doesn't cause the gastric bleeding, okay? It doesn't affect platelet adhesiveness, and it doesn't produce any uric acid excretion either. Adverse reactions, hepatic liver effects. Think acetaminophen, you think toxic, think liver, okay? It can occur after ingestion of a single dose of 20 to 25 grams or 60 to 75 pills, okay? Not that much, okay? Children, it used to be, there were infant drops and there was child's liquid. And people got confused because you have the child that's turning, the infant that's turning into a child, and people would give the infants the wrong dose. The liquid drops, because thinking for an infant it's easier to just put a couple of drops in their mouth, they were more concentrated. So they were taking the little cup that's meant for the liquid, and they were dosing it like a liquid, and it was much more concentrated. So there were some inadvertent deaths and emergency visits because of this. They've now actually made them the same strength, and you have to give the infant more of it. So they've made them the exact same strength, but it was a big problem. So the FDA increased their warning, black box warnings about that. So that would be a concern. Patients that have liver disease should not take acetaminophen. And anyone who admits to being an alcoholic, or someone that you know who drinks 3 or more alcoholic beverages a day, whether they admit they're an alcoholic or not, okay, should avoid taking acetaminophen because of the effect on the liver. Okay? So if a patient doesn't say to you, I'm an alcoholic, but when you ask them and they're honest and they tell you that they have, I have 3 beers, I have 3 drinks at night, 2 or 3 drinks at night or whatever, that might not be a person you want to give acetaminophen to, or suggest that they take it. It can be toxic to the liver, okay? But this usually, to the kidney as well. But this usually happens with long-term consumption of a lot of it. And the FDA warning is that you don't take more than 650 milligrams every 4 to 6 hours, okay, or no more than 10 regular or 6 extra strength a day. And we know that there are times where in pain we do take more than that, but that's not something you want to do, okay, or do very regularly. If toxicity does happen, people have to have literally their stomach pumped out. That is gastric lavage, activated charcoal, that kind of thing. You wouldn't do that yourself, but that's what would happen. Stevens-Johnson syndrome I talked about before can actually happen with acetaminophen as well. So if you have any skin reactions from it, you are having an allergic reaction, you should discontinue its use. And we don't always put together an over-the-counter drug that we're taking and getting a rash. Rashes happen, right? But that would be a symbol, a sign, and if you kept taking it, you might have that happen. So don't do it. Drug interactions are not common. But the toxicity to the liver can happen for people that are taking barbiturates, carbamazepine, which is actually given for trigeminal neuralgia, okay? phenytoin, which is an anti-epileptic drug, and rifampin, which is an antiviral drug, okay? And also those chronic large doses of alcohol, people should not take Tylenol. It's used for analgesic and anti-fever pain, as we talked about, okay? And we use this would be the drug of choice for a child, right, who has a fever that we think may be associated with a flu, okay? So we would want to give them acetaminophen instead of aspirin, right? Okay. The usual adult dose, so this is something you should know, is 325 to 650 milligrams every 4 to 6 hours, okay? No more than 10 regular or 6 extra strength per day, as we talked about. Children have elixirs and drops, be careful of dosage. And remember, I just talked about the change in that. That actually happened over the last couple of years, so really important to know. So if you have anything throw away the expired stuff anyway. So if you have any in your house, but just pay attention when you're looking at the children's and the infant drops. Okay. Very briefly, yeah, Jess.
When my brothers were younger, my mom would do like lotion and then Tylenol. Like they would have
Alternate?
Yeah, why is that?
Sometimes doctors even recommend that, and it's because their toxicity is different, so you would alternate it that way. I know doctors, my daughter does that too. I know doctors sometimes recommend that for that reason, so you don't get an overdose of the other one. They work differently, don't they? They're different drugs. So yeah, that's why. And I think specifically with the Tylenol, with the liver issues, they each have their. And remember that one is anti-inflammatory and the other one isn't, right? And one helps to raise the pain threshold and the other one doesn't. So that combination is actually pretty good in long enough doses. So smart mom. Okay. Gout is an inherited disease. Has anybody run into a patient who has gout? It always sounds like an old man's disease, and it kind of is, but younger people do get it. And I've had patients that have had it, and it's extremely painful. It's extremely painful.